My name's Caitlin Browniger, and I will be presenting my PICO question today. My PICO question is, would placing acute care patients with a greater than or equal to 3 fall risk score closer to the nurse's station cause a decrease in fall rates? The P stands for population. In this case, it's for acute care patients greater than 18 years of age. The I is for intervention. It is to recognize the patients that are a high fall risk and evaluate their safety as an individual and also evaluate their physical environment. The C stands for comparison, and it is to evaluate high fall risk patients, environments, and surroundings versus caring for high fall risk patients. The O is for outcome, and it's for decreasing fall rates in acute care settings. I chose this topic because falls in the hospital are a huge issue. As a nurse in the hospital, my days always consist of preventing falls and implementing fall precautions, and also assessing patients to determine if they are a high or low fall risk patient. Research design. Mine consisted of mixed research, which included qualitative and quantitative, quasi-experimental, and my time frame is 9 months to collect data from falls. Sample. My sample size is 200 acute care patients. This will include 100 fall risk patients with a score of 3 or greater closest to the nurse's station for 9 months, and also 100 fall risk patients with a score of 3 or greater throughout the unit for 9 months. This will include male and female, 18 years of age or older, and a 9-month experimental time frame. Ethical considerations. Informed consent is to participate in the survey will be obtained when medical consents are signed during admission. This will let the patient know it is an anonymous survey, and confidentiality will be maintained by assigning the patient a number. Risks include not placing patients that are a high fall risk closer to the nurse's station. This will put them at an increased risk for a fall. Benefits include placing high fall risk patients closer to the nurse's station so employees are able to keep a better eye on them and respond quicker to call lights and also bed and chair alarms. Setting it includes 200 bed urban hospital with 32 beds per unit. Data collection. We will gather data from the 100 fall risk patients with a score of 3 or greater that were placed closest to the nurse's station for 9 months. We will then gather the data from the 100 fall risk patients with a score of 3 or greater that were placed throughout the unit for 9 months. Data analysis. To collect the data, we will use the t-test. The t-test will consist of testing 2 groups of patients: the high fall risk patients that are close to the nurse's station versus the high fall risk patients that are not close to the nurse's station. The conclusion: this research proposal can be applied in other areas of healthcare such as nursing homes that consist of assisted livings, memory care, transitional care, skilled nursing, long-term care, and respite care.